Hello everyone. So like I said in my last video, I'm going to do a quick review about COPD as a whole disease instead of classifying chronic bronchitis or emphysema. So here I'm going to explain you the overall COPD, chronic obstructive pulmonary disease. Now in the name, as you can see, it says chronic. It is a chronic disease. Pulmonary, it's related to lungs, and it's obstructive, so that means it's related to the flow between the air in between the lungs. Okay, so if a patient has a chronic obstructive pulmonary disease, COPD, it will produce general characteristics like cough with sputum for 3 months for consecutively 2 years. So a patient with chronic obstructive pulmonary disease will produce cough with sputum for 3 months for 2 years. Now, if you see a patient with this type of condition, you can almost identify that it is COPD instead of running furthermore test. But it is up to 70% chance that a patient has COPD. Now, let's see other characteristics like alpha 1 antitrypsin deficiency. I have written it in the short form. So alpha 1 and antitrypsin. Our lung has polymorphonucleic cells, macrophages, that clear out our cells lining all that unwanted stuff. And for that they release a substance called protease. Now sometimes protease activity get uh, out of control, and so that our body has a defense mechanism that is known as alpha 1 antitrypsin that reduces proteases activity. Now if you have this type of deficiency, if you have a deficiency of alpha 1 antitrypsin, then what happens that your proteases will go uncontrolled, and they will start to damage the lung parenchyma, lung alveoli. And this is what happens in COPD, in emphysema, which is also common in COPD. Like I said in my last video, in emphysema there is a destruction of alveoli wall, and it's happened because of the alpha 1 antitrypsin deficiency. And the last characteristic is chronic asthma. If you have a chronic asthma, you should test it in the patient for COPD, because asthma and COPD are like twin brothers, and they have so much in common that you won't find it very arousing. Now, the clinical features for COPD are prolonged expiration. The patient cannot get his or her air more quickly out of his lungs. There is abnormal breath sounds, there is tachypnea, and there is cyanosis. Patient can't have enough of oxygen, that's why the patient is tachypneic, and that's why the patient is cyanosis. And sometimes also patient use accessory muscles like strap muscles in our neck. There is a cor pulmonale present in COPD. It can be another disease also, because it is, like I said, a chronic disease. Then so you can expect some few more diseases with it. Now for diagnosis, now here you will understand that COPD asthma share so much in common. The diagnosis is for COPD is also spirometry. You test pulmonary function test. You check forced expiratory volume and forced vital capacity, which is if the patient has COPD, will be less than 70. Now we characterize it as, if you have mild COPD, you have 80%, your ratio is 80%. If you have moderate, your ratio is 50%. Severe, your ratio is 30 to 50%, and very severe, your ratio is 30 less than 30%. Now other thing you can do is chest x-ray for inflation of the alveolar wall, a flattened diaphragm, and an increased retrosternal space, because there is a destruction of alveoli going on. Now for the treatment, the patient usually of the COPD patient are usually smokers. You can tell them to quit smoking, and which really helps a lot. You can also give anticholinergics like ipratropium bromide. You can give them beta 2 agonist albuterol, just like asthma. You can give them inhaled corticosteroid budesonide, or you can give them oxygen therapy. Now I write oxygen therapy in this because I want to tell you two extra points about that. When the patient can't get enough of oxygen, the patient is usually hypercapnic and hyperoxemic. That's why you also should test for atrial blood gas. And for last and not the least, you can also measure the alpha 1 antitrypsin amount. it is genetic, so you should test for it. So that's why I write it here, oxygen therapy. Now you can give them systemic corticosteroids, but in IV, but for only for hospitalized patients. You can give them methylprednisolone, or you can give you can give them an NPPV, non-invasive positive pressure ventilation, if the patient is very severe, cannot breathe on his own. Now, for giving them corticosteroids, there is some kind of side effects. The patient have will become prone to oral candidas and other infection. So for those, you can give them antibiotics too. That is all for COPD.